Hello. So in 7 days, it will be 6 months of my radiation oncology residency. So here is like detailed journey review of my 6 month residency. I've not wrote down anything. It's just raw emotions and whatever I have felt throughout this period. Uh, so let's start. First of all, about residency. Residency will take away all your time. I don't know how to frame it, but yeah, it will take away all your time. You don't get enough time to sleep. You don't get enough time to go out. You don't get enough time to play and also to do other stuffs you have planned after in the neat PG preparation period you have planned like I will do this thing, and then you join residency. You find out that I don't have enough time to do that. So this is first thing that I have realized in the past 6 months. Then thing you have to do in residency, you have to take you whenever you get, and you have to get rid of the idea that you are eating in a odd time and that is why you are getting weight. A lot of weight gain is there. In my case, I have not gained enough of it, but yeah, there is here and there is some fat deposition. You can see in my face also. You can see some fat deposition, and there is my belly which is protruding out. Yeah, I do gym. I do have a tracker for the calories I take, but I don't know how because I am not maintaining the calorie deficit thing. Because if I maintain the calorie deficit thing, I will not function as you like as I do. And then there is this thing of sleep. So residency, uh, our branch is not that hectic like surgery or medicine, but yeah, there are times when we get a dicey sleeping pattern, and then you get to know how to modulate that thing. You have to take supplementation to sleep properly, or your 24 hours on call, post on call night. You have to sleep properly, otherwise you can't work. So the takeaway point is just try to sleep as much as possible, and whenever you are getting some time, don't waste it doing anything else other than taking rest, because recovery is one thing that will keep you safe, because this is a long journey. And then you have to realize, or my realization is, you have to uh, keep your emotional part out of your work zone, because cancer is one of the most devastating thing that can happen to someone else, and treating cancer day in and day out will make you depressed, because it will just keep you awake in the night saying why I choose this depressing branch, or every now and then when you will see death, you will regret choosing this branch. But at the end of the day, there is so much of like it's worth your time when you like give a patient progression free survival, disease free survival, that will be worth it for that reason. And then like not to desensitize, but also not to get too much of soaked by the emotions that death can bring. So in my case, I have seen 6 or 7 emergencies, and that lead to not 6 or 7 emergencies, 6 or 7 deaths. And that death was the age between 20 years old female to 60 years old male. And every time someone has passed, there is some kind of emotional baggage they give you. It's your choice. You can keep carrying on this baggage, but it will eventually do more harm. But if I do one thing, I'm not a religious person, but whenever someone dies, I pray to my God that in this life they have suffered so much. If there is any afterlife, please make sure that they get a better life. I don't believe any human being has done anything in their before life to deserve this kind of pain, this kind of disease. So I always pray for like a peaceful ending of their day. So after seeing so many deaths, there is one point you should remember that it should not desensitize you because as a doctor, before a doctor, you are a human being, and our one of the finest qualities empathy and our emotions. So if you get desensitized by death, the empathy will be gone and you can't relate with the pain. You have to relate with the pain, but you should not carry the baggage. Emergencies. I have worked in ENT. I have never worked in emergency medicine. I have never worked in medicine department apart from my internship days. So most of the deaths or most of the thing we see, apart from the oncological emergencies, there are emergencies that arises or the patient that comes in our outdoor or in the IPD is mostly dyselectrolytemia, and it has gone to some extent that I have started teaching myself from YouTube different type of the dyselectrolytemia and their management. I have learned a bit. I have managed many patients of dyslexia by my own. I am somehow proud because I have taught myself that. I've asked my seniors, they have taught me also. I have seen medicine guys how they treat the dyslexia. And yes, you can learn by observing, you can learn by asking your seniors, you can learn by your own uh, active effort. So basically there is no straight way you have to learn this thing this way and you have to implement this thing. Just you have to be curious and you can learn so many things by your own. In residency, apart from being uh, like being overburdened by the work, you should always keep a mind open that you want to learn, you want to do some things. So that is one part that I have learned about managing so many things. And thanks to my seniors, thanks to my co-PGTs, thanks to those from the other departments also, because for them I have learned so many things, and I will forever be grateful for the learnings I have received. Uh, now, now about academic. So in our college, the academic is like very high. Like people, our seniors have literally ranked in the university exam. They are doing great in their life, and our immediate seniors, they are also good. They are studying their heart out apart from working. So it comes as an invisible burden to teach yourself to learn. In residency, it is said that I'm not talking about the surgical branches, but in the non-surgical branches, you have to read a lot. And radiation oncology being a new subject to me or all my co-PG is like it is a like a different ball game. We have to learn so many new things. So if you are coming in radiation oncology, always keep in mind that you have to learn a lot. Yeah, seniors will help, but you have to learn yours by yourself. So many things. The seminars will keep on going. The journal clubs will keep on going, and then someday you have to submit your thesis, which I have the thesis in 1 week or two. So that is the part. But you know what? Like after work, after so many things, we don't feel that pressure of studying. We try to study, we try to know about things, why this is happening, why we're giving this, not that. When the concurrent is working, when the concurrent is not working, when people are getting 3 weekly cycles or 2 weekly cycles, all this curiosity, and you have to, like, even if you are not curious because of the work, because of the working demand this branch wants from you, you will eventually learn from this, from, like, by yourself only. That goes the academic part. And then the experience, yes, the experience is amazing. There are certain set of patients who will come to you and they will say, that is the doctor I want to get myself treated from, or I was treated by himself, and I just want to talk with him. So every patient, a subset of patients, has a specific PGT or the resident who is their favorite. I have, fortunately, by God's grace, I have so many patients who, like, comes to me, ask, I counsel them, I clear their doubt, I reassure them, and this is something I find, like, very fulfilling. And this kind of fulfilling, I don't know, like, I have seen seniors saying this kind of fulfilling you can't get anywhere. So yeah, might be because I have not worked or I'm not that kind of experienced person to say this. But yes, but I feel good having this kind of interactions with patients now. So you have like 3 or 4 domains: your personal domain, your work domain, and then your family domain. Personal domain has your own life, and if you love someone, their life and their uh, mental state. Family comes with a lot of things: the responsibilities, the mental burden, the happiness associated with them, your siblings, your parents. You are, like, you are their hope also, of your parents also, and you are your brother or sisters, like the helping hand, their guide if you are elder. And then the work. So these are the domains that in residency that get messed up a lot, because they were intertangled throughout your life. And in residency, the work domain plays the major role. So in work domain, you have to have a peaceful mind, you have to have a smile in the face, professional smile or whatever, and a mood that is always elevated. Not necessarily 100% of the time, but 80 to 90% of the time, because you are treating patients, you are treating the patient party also. So having a good mood, having that kind of energy to talk with them, counsel them is very important. So when you are in residency, specifically if you are in radiation oncology, you have to realize that these are the very intricate domains. But when you are coming, like, you can have many problems at your personal life, many problems at your home, but when you are working or when you are coming for work, you should always have a smile, you should always have a empathic mind, and you should always listen to the patients and the patient relatives problem, because they have all their hope on you. That is why it's very important. Now, what to tell about money? If you ask these questions to anyone doing their post graduation in West Bengal, they will say the money is not enough. And I'm saying that too. Money is not enough. I have barely saved anything, and I have not started, like, doing a deep kind of investment, which I should do. And I'm not, like, too proud to say this thing. Actually, I'm ashamed of saying this thing, that I should have planned better. But I have not, but yeah, I'm actively trying to plan better to get into more into investment, the wealth building kind of investment, not the F and O kind of investment. So let's see how I can perform in that. So in 2 weeks, the NEET exam will be there. If you have any kind of inclination towards radiation oncology, just ask in the comment. I will try to answer as much as possible. And yeah, about the duties. So duties we have like the chemotherapy daycare outdoor we are doing till now. We have not gone for the brachytherapy or the machine duties. Machine duties whenever will start, I will give a review as I have said earlier because like there are some issues in our department. The first year PGTs are still stuck with chemotherapy duties. So let's see how fast we can go there. And as soon as I go there, spend at least 1 month, I will share my journey from there. Peace.